so wonderful to be here, and I'm really grateful to Duke Global Health for inviting me. One, because it's exciting to talk about the work that we've been doing for a while, and also really exciting, I'm hoping, to hear about your views and your opinions on the work that we've done. So to get started, I basically structured the presentation like a standard kind of research presentation, but you're welcome to stop me at different points and ask questions if you're not clear about what I'm talking about or I'm not presenting clearly. So I've just given you a bit of background about our study and the objectives, and telling you a little bit about the context that we worked in, because I imagine that you might be unfamiliar with that, and then the method that we used, and a bit of discussion about the results and our participants and how we analyzed the data and how we came up with some of the ideas that we've developed. So there's quite an overwhelming burden of disease, especially in South Africa: TB, mental illness, HIV AIDS, all of which is really overwhelming the health system. And what health systems are really doing now is processes called task shifting. So downgrading healthcare practices to unskilled or less skilled health workers in communities. So task shifting is possibly a solution, but the issue is that many healthcare workers or community-based care workers really don't have the kind of training that you'd expect them to have. Often they're volunteers that come into the system and then start to learn as they're there. And community-based care really forms a mainstay of care for people who with palliative illnesses and serious illnesses that come from cities and then go back to their communities, usually quite rural communities, where there's little access to formal health care. Community caregivers then go to their households, which might be kilometers away from a local clinic or even a road for that matter, a tarred road, and care, either providing medication, providing support, any kind of palliative care. As I said, mostly unskilled people. What has been noticed in the literature is that caregivers are generally quite burdened, and around HIV and AIDS care, which it started with, but it's now evolved into other types of care. Caregivers are burdened both physically, psychologically, and really in terms of resources as well, because the health department really doesn't support the care in terms of providing them training, providing them resources. So if you can imagine, here you are, an unskilled person. You volunteered because you've seen the need in your community, and you're walking around day after day trying to help your neighbors. You have no training, so you're mostly overwhelmed by even things that basically skilled workers would find quite manageable. You don't have equipment, bandages, fresh water, just simple stuff like that. So you keep going out every day, and you're coming across people who need your help, and you're not equipped to help them, both in terms of your skill and in terms of the resources you have. So what has happened in these communities is that you can imagine that the turnover of people that give care is quite high. So you'll come into this kind of job or this volunteer position, and you'll do it for a while and then realize, well, this is over my head. I'm not going to do it anymore. I can't do it anymore. It just becomes too burdensome, and you leave. So there's a high turnover of people that do this kind of work. And you might wonder, why are people doing it anyway? Well, there are two reasons that I've done research in another area, and there are two reasons basically that people will do it. One, because they recognize the need in their community. And two, once people start to offer this kind of care, they usually get some minimal training from an NGO or some other possible healthcare volunteer who will come in, and then they get a little bit of skill, and then will be poached almost by NGOs that offer care in a village or a town or city. So people start by volunteering to get recognized as being a caring person, a caregiver, and then get a job or a paid job in a city or a town close by. So what we found, Neil and I, when we went down to Ikopo, which is about 100 kilometers outside of Durban, which is a big city in KZN, is we found this organization called Rosa Moya, which means call the spirit. And they have a group of caregivers and have been running for about 15 years. So they do just about what I've been talking about right now, offering care to the community around social support, health care, anything to do with welfare, social support, and healthcare to the community. But what is unique about them is that they're self-funded. They're a self-funded NGO, And even more so, most of the caregivers, if not all, have been in the organization for at least 12 to 15 years, which is quite unique considering the high turnover. So having done research in an area previously and found what the high turnover is, and being impressed by the burden of care that these people experience, we were really curious to see, well, what is it that Rosa Moya was doing that made caregivers stay longer? What made them persist? What resources or what was happening here in this particular organization that made them stay longer? And here's where Rosa Moya is. It's actually a beautiful place in the valley of near the Valley of a Thousand Hills, and this is their kind of headquarters. So this is how they're organized. So one of the things is that they had an organization, they had a leader. So there is a director and two managers. The two managers and the director are from the original grouping. And then they have developed over the years a kind of support system, donors, both international and local donors. They have partners in the community and outside of the community. And they have volunteers, which come in a lot of times from Durban to teach the group skills, to do some kind of support, to help with cleaning and care. Some retired people, some volunteers from just organizations. Then they have home visitors who are part of the community caregivers and will go from home to home visiting people who are ill and who need to be cared for at home, and then community caregivers who liaise with the organization and the community to provide community support. So they have, and this also makes them unique in the sense that we have a defined structure that's arisen from their interaction with the community, and they're having a core team of a director and managers, which is quite unusual. So it's unique because it's longer in existence than most similar organizations. It's had a fairly stable staff over 13 years. It maintains a consistent presence. It has a close association with the local community and nearby Buddhist retreat. Now that's quite unique. That was quite different. The Buddhist retreat, how it happened is the three main core management team were used to work in Buddhist retreat and were volunteering at the Buddhist retreat, and then discovered there was this community in need of care. Started offering care on the weekends and realized, well, this was not going to be enough. And then started raising funds themselves and gathering women in the community, and then moved across to the building that I showed you earlier and started to develop an organization on their own. Over the years, they have maintained contact with the Buddhist retreat and have had the opportunity to have people that come true to the Buddhist retreat to teach skills like mindfulness, whatever they're teaching, mindfulness, yoga, reflective practice, also teach skills to their community care workers. So this is how the community care workers have started to use reflective practice and mindfulness skills amongst their staff and support workers. So what we wanted to do in the study was to find out how they use mindfulness skills, what their ethos was, how did they come to decide that this is something that they wanted to use, to explore how mindfulness and reflective practice originated, how they use them in the organization to contribute to the longevity, which was something, as I said earlier, was quite unique, and to explore how members in the organization benefited personally and in their work from using it. There were hundreds of things that we could have tried to do, but we tried to associate the longevity of the organization and the success in providing care with this particular practice, which was unique. So we did that by interviewing the core staff, so the manager and the project managers. And when I say project managers, they're not on like corporate kind of project managers. They're local people that have been co-opted or volunteer from the community and get funded by local organizations or international donors and get small salaries. So the project managers would manage the legal service or the social service. A lay person really, who in learning how to project manage gets the skills but gets a paid job as well, but are local people who have local knowledge about the community. So we spoke to those core people that are working in the management and the implementation of the services, and we spoke to the community caregivers, who are women who go out into the community, members of the community themselves, go out taking care of friends, neighbors, but are paid workers in the organization. There are about 30 to 35 of them. And we also spend time in and around the Buddhist retreat and at Rosa Moya, driving around with the care workers, observing their groups, seeing how the organization runs at different times over a period of about 18 months. Although both Neil and I had previous association with the organization before starting to work with them. But in the time of the study, we spent time going back and forth, learning about their systems, their administration, how they did things, even things like how they spoke to each other, their philosophy of how they interacted with each other as people within an organization. So this is another view of where we collected the data, and in there you can see us running the focus group. So most of the care workers speak isiZulu, and whilst they do speak English, we thought it was important for us to get really detailed information from them. So you'll see Neil, myself, and a colleague of mine called Casper, who I'd worked with previously, and who's an excellent translator. So we co-opted her from another area in KZN to come and help us translate, because she had a lot of experience working with caregivers, and it was very uplifting experience to engage in that way. It was quite important for us to be able to use isiZulu, even though the care workers could speak English, to access information around stuff about mindfulness and reflective practice. We wanted people to be able to speak authentically in their first language and not have to struggle across barriers. I think it was easier for us to struggle across a barrier. So we analyzed the interviews using in vivo, which is a qualitative data program, which I think you might know. I'm not sure if you know it, but anyway, that's not important. And we used the ethnographic data, our notes, our videos that we took, and just observations that we made and discussions that we had afterwards to try and understand the data that emerged. What we found is that Rosa Moya uses what they call circles, which really are groups that they get into that conform to a similar structure or format, and they use it in a couple of different ways. They have a morning circle, which is daily meetings of the people that meet, and they just check in with each other. We'll show you what that's about just now. The Rosa Moya staff, which consists of about 50 people, meet every 2 months and do also reflective practice, touching base with each other, finding out what the challenges are, listening, and doing some reflective practices around mindfulness and maybe breathing exercise, and you'll learn a little bit more about that just now. The caregivers that go out into the communities also meet monthly and have reflection groups with the leader, where they share their difficulties that they come across, the difficult things they see, the hopelessness, fear, illness, triumphs that people are experiencing. They share with their colleagues and learn from their colleagues. And then community groups is where the caregivers or project managers will go out into the community and have groups with people living with HIV and coping with having to take medication and whatever challenges and issues they face, with parents in the community, young children, older children, drug issues, any regular issues that parents are having with children. And then gogos, I'm not sure if you know what that are, but in South Africa we have a phenomenon where there are many vulnerable and orphan children as a result of HIV. Many parents have died leaving children unattended, or parents move to the city and children get left behind in rural communities with the grandmothers, and grandmothers are called gogos. It's a very common term in South Africa, and usually the maternal grandmother is left to care for the grandchildren. Now sometimes parents will send back money, or other times if the parent's deceased or has just left, the grandmothers will not have money to take care of the children. Now Rosa Moya has a social support system where they have a project manager to help the grandmothers access care grants, which the government provides, but it requires a lot of paperwork, and they're usually isiZulu speaking women who have not been educated because of the legacy of apartheid and really don't know how to negotiate a administrative system. I mean, it's hard enough for many of us who get there. You know what it's like. So Rosa Moya will also help these women go and access a care grant for their children and provide community support. It was very interesting one day when Neil and I were sitting on the top of a hill waiting with the care workers for a go-go support group to start, and we waited. It was about 1 o'clock in the afternoon, and the group was supposed to start at 1. And then around 1:30, old ladies with walking sticks started walking slowly up the hill in no hurry to get to the group, and it happily started. And then they got there at about 2 o'clock, and they thought, well, the group's going to start now. It didn't. Everyone broke out some bread and apples and had a nice lunch very calmly, and you'll see a picture of it as well. So it's just about, it's not, and we thought, well, why isn't it starting on time? We know they need to get to the group. And it really isn't about that, it really is about mindfulness. It really is about taking your time to greet people, to acknowledge them, to give them an apple and a space, and acknowledge that you're a human being. And really it was a lesson in what mindfulness really is about. It's not a respect for time, it's a respect for people. And yes, you can arrive at the same time, and that's respecting people, but to respect people in other ways, and that you might have had something to do, and the fact that you're 86 years old and had to walk up alone on a hill with a walking stick is something I respect. It would have been nice if we had more than a chocolate bar to share on that day.
Just have a question.
Yes.
I might have missed this. Who was attending the morning circles at daily meetings? Was that volunteers for that specific day, or?
So Rosa Moya has a program every day, every month, which they put up on a notice board, and there might be different activities going on. So there might be a caregiver group or a child group. So whoever's meeting at the office on that morning, the staff members will attend the morning group. So it's usually the director and the 2 major managers, and any staff member that's at the main kind of headquarters will attend the morning group.
And visitors like us.
And visitors like us, we would participate as well. So this is a group that we attended. This is actually the group on the hill. After waiting 2 hours outside with some goats and some children that we made friends with in all that time. And this was eventually the group. The group started with lighting a candle and taking a couple of minutes to just center themselves and sing and pray, and then very patiently started the group. And it was very clear that they knew what the process was, because everyone just participated very smoothly in the process. So this was one of the groups that we attended as part of our ethnographic study. So what were the results of what we came up with? We saw that the influence of Buddhist practice and philosophy was very big in the work. The mindfulness, being very observant of what you do, the inclusiveness in the community. And this was influenced by the fact that the director and the 2 core staff members were from originally the Buddhist retreat. The close association with the Buddhist retreat really influenced them. And the volunteers visited the Buddhist retreat to learn and teach skills. So often there'd be somebody from some university or some spiritual organization that were visiting the Buddhist retreat. And the team at Rosa Moya were very resourceful. They'd find out who was there and say, could you come and do something for us? They would teach them a skill, they would teach them a relaxation exercise, maybe a bit of yoga, anything that they could learn, they were happy to. So that's the Buddhist retreat next door. They run yoga groups, they run mindfulness groups, painting, writing retreats, all sorts of things, just as our retreats usually do. There's a big statue in the gardens, retreat gardens. So the morning circle, this is one of the, let's answer your question, one of the people said about the morning circles. There's a song and a prayer, and it's very simple if you look at it, but it's so profound in its impact on people. So people just stand around, they sing and they pray, and they say 2 lines about how they're feeling, something good and something not so good about what's happening to them. And when we asked about what would the purpose of that be, and why you didn't need to comment, you'll see the person said, well, we don't want you to tell more about your story. So later, if I commented about, well, I'm feeling a bit down because I had a flat tire this morning, well, no one would ask too many questions, but a friend or some other colleague might come and say, well, did you get your tire sorted out? And then there'd be someone to connect with me and perhaps understand. Or if I'd lost a family member or my dog was ill, someone would understand why I was not quite present on the day. So that was the purpose of the morning circles. And then every 2 months they would have then the reflective practice circles where they would learn new skills and practice reflection. And sometimes they would use a talking circle format or meditation format. It wouldn't really be prescribed as to what kind of reflective practice or mindfulness practice they would use. It was almost a mishmash, but we'll see more about that later. So as one of the people said, it's always different. They might do body sweeping, they might do meditation, and really when we observe the groups, there would be any different kind of mindfulness practice coming from anywhere, and just to know what was going to turn up. It might be breathing, it might be lighting a candle and meditating, it might be a body sweeping exercise, it might be a deep muscle relaxation. You just didn't know what was going to come up. It really wasn't prescribed and structured. It was a process that people followed, but it was very organic in the way people did it. So one of the benefits was it, and this I thought really stood out, because as psychologists and in psychology, and if you know anything about counseling, you'll see that listening is really so important. It's the core of what we do and what we try to do. And most people will start off thinking, well, I'm a good listener. But really, listening is a skill in itself. And it's very interesting for me as a psychologist to see how people recognize through this process the benefits of listening and being listened to. So being an active listener, being present with a person no matter where or how, and just to be present with this person would be empathy. And that really struck me as being very, very powerful. We have video to show.
Please.
This is the morning circle.
So we were with the community care workers today, doing a reflection about things that they are doing in the community, highlights, what went well, challenges, and also solutions for the challenges. Sometimes the community care worker goes to the community, and sometimes they carry a lot of things on their shoulders. So it's the way that we support our community care workers.
Can you remember some examples of things mentioned that were going well today?
They say the people who are taking the treatment, they are not defaulting. There are no many people who are bedridden now. They like to say they thank you, Rosa Moya, because 8 families were given to village kids. And there are challenges in other households. There are orphans that their aunts were misusing their grants. They are not looking after these orphans. Instead, the aunt is buying things for her children, not these orphans. They must report to the social worker and or come to Sbonelo or Paraliban to report their case so that they can be assisted. Our community care workers are working in the community and they find a lot of challenges. Sometimes they sit with all these challenges. Sometimes we will see them, they are not performing well because of these challenges. But if we just ask them to come and just tell us everything that they met, so they will relieve them. they talk a lot and they reveal. Together they can find a solution, because you will find that sometimes the other care worker met with the problem and she solved it. Then they help each other.
Some of the feedback we've had from our care workers is that they find these conversations very helpful because they learn a lot from each other's sharing. Often one care worker will raise something that actually brings up issues for other care workers. And the whole group, doing this group process is very powerful. There's a lot of learning and sharing that takes place. So not just reflecting, but actually learning from each other's experiences. So the group process is a very powerful way of doing it.
Okay, so we interviewed, yes.
Sorry, I have two questions. The first one is, I see a lot of women, so I imagine it's mainly women, but does the NGO participate with men in the community?
Yes, they do participate with men in the community in different ways. There are men in the NGO as well. There's Bonello, who's the paralegal, and there's some people on the video team. But there's other, it's interesting that you've mentioned that there's other research that's been done about caregiving in women. There's a paper that I've written as well around how caregiving is kind of dominated by women and even held by women as a woman's thing, and men might even be actively excluded from it. So there's something around that as well, that women get some of their identity value from doing the caring work, which is one of the things that they get to do without interference, as it were, from men. You had another
And the
question?
other thing is, I don't speak Xhosa or Afrikaans or anything, but I was hearing the word Jesus in the song and the initial part of the video. So there's this interesting like syncretism, maybe with like the Buddhist part of the NGO and how they're delivering services. So could you expand a little bit on that, on what's the religion of the participants or caregivers? How is that put together culturally?
It doesn't even seem to be a problem. Buddhism really does more of an encompassing practice, and none of the people mentioned any kind of issue around that. Yes, most of the morning songs are around Christian church gospel kind of songs, around asking for blessing, which is what the song was about. But it doesn't really have, no one mentioned anything in conflict. People do the practices.
It is a really interesting question. I don't think that the women, I could be wrong, what do you think? They wouldn't recognize the concept of Buddhism. It's not like we're gonna teach you Buddhism. They know these practices that they do, and they're all Christian. The women are all Christian, and that's their belief system. So it's not exact, it's sort of like syncretism, but it's more like just the practices, the methods, the techniques come from the Buddhist Retreat Center, but the foundation of their own spiritual system is, if there's any syncretism, it's between like the Zulu, want a better word, indigenous beliefs and Christianity. It's more like what's constantly mixing all over the country, or whatever there is indigenous with Christianity or with Islam.
Thank you.
It's an interesting question, and I mean, I have to admit we haven't considered it because it wasn't something that was brought up. Everyone just seems to just do it.
Yeah.
It's an interesting question. So when we looked at the interviews, we found that just from an outsider researcher perspective, really the people were getting the benefits that usually people get from groups, which is universality, sharing a common experience, catharsis, just letting go of stuff, being encouraged to talk in a circle kind of group because you hear other people talking and see the benefits they get from it. The issue of confidentiality, sharing information about vulnerability, difficulty that you were having, and knowing that other people would keep that information and not put it out there. And the intimacy, sharing common experiences and just having a space that was uniquely theirs to discuss issues that were uniquely theirs. So this is the inside, and this is one of the times where people were just working together. And what was really interesting about the space is it's a room smaller than this, but so much goes on there. It's like a birthing space where everything that happens in the community, it just changes its form depending on what people require. On one day it might be a meeting space, on another day it might be a space where we give a lecture or give results back, and all the time sewing is happening in the corner, and people are working on a computer, and somebody's editing a video, and it all happens very smoothly in the space. No one seems to get in each other's way. There's just such a smoothness, and the room is just one room. I think for me that was really amazing. So what other benefits that people got from the group were an opportunity to learn practical ideas about domestic violence that they encountered in community, health, hygiene. They had the opportunity for self-reflection and self-management, seeing how they view things and what the values or the negative aspects of how they view things were for themselves and the people that they were working with. They learned about the skills of discussion and how to discuss and communicate. So this was interesting because even though they're part of a group, people are out in the community, and it's only when they come for the monthly groups that they might meet people that have the same experiences as them. So this is a picture of just outside the community group, chatting to people that have the same experiences that you do. Also listening and developing interpersonal skills about how to relate, find relational skills, reflecting on personal relationships. Many women told us about how the reflective skills and the skills that they learned about interacting and thinking about relationships, they managed to generalize to their own families and their own relationships, sharing with their children and their husbands and other family members. And also the social and community benefits of sharing with the community things that they learned from Rosa Moya and with each other, collaborative skills when working with groups in the community and discussing and finding solutions. That in itself is a skill, which we might not think having practiced it, but it is a skill that you learn, and it was what they recommended or they put forward as an important skill that they picked up. This is the paralegal having a consult with one of the community members, probably about an old age grant or something. So what can we learn from what Rosa Moya does? We learn that they make specific time in the program for reflective practice, that no matter how busy they are, thought is important. It seems frivolous. It seems like, well, you need to be have time in your day. They made time, even though they were literally dealing with life and death issues. Initially, they had a champion, so someone who was pushing it. When it didn't seem that there was time, someone, which was then the director, said, "This is something important. We have to make time." And she mentioned how she had to almost force the issue and say, "This is important," until people started to realize and experience the benefits of it themselves. They practice it consistently across different platforms, in their support group, for themselves, in their personal lives, in the morning circles. So they practiced across different platforms. They used a variety of methods. They weren't kind of precious about how they used it. If they got something, they tried it out, they used it. They were not strict about method. They used it with the ethos of mindfulness and reflective practice infused in it. They adapted the method for the context. If something that they learned from the Buddhist retreat didn't quite work, they would adapt it. If it was a method or a technique was not quite what they understood, they would adapt it. We saw them do that. And they constantly got training exposure from outside people that came. They really made the effort as an organization to invite people and to try out what people who had been invited had showed them. And most importantly, they really trusted each other to implement the process. That once you learned how to do this, you expected to go out and do it. And you were trusted that you would not just only do it, but that you would do it well and that you would continue doing it. And that was probably the most impressive thing. So after we got all this information, what we then decided to do was to go back and tell the community members about how we learned, or what we learned about the community, to check back. And I think we'll talk about that more at an event on Thursday evening. So we met with Sue and who's the director and the major team, and we said, well, this is what we learned about your organization and how you do things. And we we had a Taking Back event where we provided some lunch and had an event where we told everybody about what we learned and checked and verified with them that we saw them in the way they wanted to be seen, which was really a way of getting closure to the whole process. So that was it. Thank you very much for your attention. I'll take some questions.
I know you, and this is really interesting. Thank you so much. I studied a different kind of caregiver myself, so this is really fascinating. When you chose caregivers who had stayed with caregiving for a long time, and so that's a really important kind of behavior that you see. Do you get a sense of their mental health? Like, do they have, and by that I really mean like their positive mental health and positive emotions and such in their lives?
Yes, they were very positive, very forward-thinking, and yes, we got, especially in the groups the focus groups, we had the opportunity before and after and during the focus groups to talk. And I think even before we decided to that, we are impressed at the atmosphere in the organization. Everyone is really supportive and friendly, and when you do visit, that's what you feel. You really quickly become part of the family. And everyone's really supportive of each other. It's not a fake kind of support. There's also, rules, and there's also, all sorts of things like that, but it's a very genuine kind of support that you feel. I don't know, Mia.
Yeah, I think it's true.
Yeah.
Thirusha, can you comment?
Sure.
So, I just wanted to add a few things to Thirusha's presentation, which was so wonderful. Thank you very, very much. To start out with, I stumbled upon Rosa Moya because I was at the Buddhist Retreat Center on a retreat and was asked to come over and give a presentation about skin manifestations of HIV infection, which is my area, one of my early areas of research interest. And so I did that, but in the course of doing that, I did a home visit for a child with a skin disorder, and one thing led to another. And I was completely blown away by the organization and just the feel of it. It was just something I had never witnessed before. And then I kind of, over the years, went back a few times and then contacted Thirusha, who has all the research expertise, unlike me. And we collaborated on this project to try to really propagate the techniques or the methods that are used in Rosa Moya, and I hope that they would be useful to other small NGOs that are doing similar kinds of work, as you mentioned. And as Thirusha was speaking, it occurred to me that something came into focus. We were just witnessing this, what I think in the end was an accidental collision between a Buddhist retreat center that was built there mainly because it's a beautiful area. I think that would be the motivation why they were there in the first place. The Buddhist retreat center and a community that was struggling with the burden of HIV. It was like this, it just happened. And then there was this kind of stuff that resulted from that collision that was unpredictable, unique, and maybe worth trying in other places because it just happened that way, and and that was what happened. And I'll just add one more thing, because Thirusha and I were, as you would expect, impressed by different things that we witnessed. I think it's true that the ways that mindfulness, reflection were practiced in the groups was random to an extent. There also was a sort of suggested group of activities that people often did. And the one that impressed me the most, and Thirusha's tired about hearing about this, but I have to say it. The one that impressed me the most is a particular activity where the women, they pass around like a talking stone, which probably comes, I suspect that's Native American. I have no idea how they even ended up at the Buddhist Retreat Center, let alone at Rosa Moya. But the women pass around this stone, and that is the person who holds the stone is the person who is speaking, which prevents interruption in a way. But then the most amazing thing to me was that the women are asked to speak about their accomplishments and their challenges. And these are like the go-go's you saw sitting around in the circle on top of the hill. And every time somebody speaks, the woman immediately sitting to her left is required to say back what she heard, to repeat the thing the woman said. And the women told us this was a very important technique, and the reason it was because they knew that they were being heard, that somebody was listening, that their message was coming through. And I thought about this a lot because in my own work, I teach, at Duke, I teach doctor-patient communication. But I've also tried to create courses in the same area in Ethiopia, in South Africa, in Botswana. And I'm always struggling to find what it is that's like a universal need of people, like no matter where they are. Is there such a thing? And it just occurred to, and one of the techniques I teach to doctors at Duke, for example, would be saying back what you've heard. So what you're saying is the pain started last week, it's getting worse, the medicine isn't helping. And it's a magical technique because people know you were listening. The patient knows you were listening. And I think that's sort of, if there's a universal need, I think that's it, which is to be heard. And that particular reflection technique really embodied that. It met the need. And there was a number of techniques in the circles that struck us as being things, if only other NGOs would do this, they would have, we think they would have more, they would have less turnover, for example, and women and people working there would be happier. So that was kind of how we got, that sort of describes how the ball got rolling also. Sit back down.
It sounds like this organization is very unique in how it came into existence, and your study is really wonderful and shedding light into why it works. And so I was wondering if you could talk about opportunities or feasibility of scaling some of these practices to other similar NGOs in South Africa to help their caregivers and help them to be able to sustain their work.
Yeah, I think it's going to be, the challenge for us is how to do that. So first we'll have to write up quite formally how they've been doing it, and which is about what we're about to do. And then, yeah, it's some, I don't know how we'll do it, but you're right, that was the intention. I'm not sure how we'll do it. Because as you know, mindfulness and reflective practices are usually considered a pretty middle class kind of thing when you already have everything and you want to enter a new plane, but here people are using it quite practically. We'll do that. Not quite sure how we'll generalize it, but it's definitely something that we have an intention to do.
Thank you for the talk. That was great, by the way. You mentioned that they had, the Rosa Moya sort of has like a high retention rate. They've kept a lot of people on for a long time. So I'm wondering, are they still bringing in new caregivers, and how, if they are, how easy is it for them to sort of become part of the group? Because it seems like a lot of these systems the systems that they have are sort of well understood by the group, and it's almost like implicit, they're not even need to be explained. So is it easy for new people to join in with that?
Well, the last time we were there to do the Taking Back event, there was a new member, and she seemed to have been there for about 6 weeks to a month, and she was quite integrated already. So two things do help to integrate people back into the system. One is that because it's quite an isolated area, most people come from the area, so they're aware of Rosa Moya. They usually have had some contact and benefit from engaging with Rosa Moya, so they know what it's about. And two, because they constantly repeat their practices, so it's not as if, well, we know now, we just go ahead and do it. They're constantly repeating. They're constantly having the morning circle. They're constantly going over and repeating, not just for new members, but to reinforce. So those two things do help people integrate.
I had a couple questions. My first one is kind of jumping off of the one about scaling up. I know that a lot of research in terms of mindfulness practice in medicine says that it's most efficient when the practitioner practices mindfulness themselves. And so how would you kind of encourage that kind of buy-in in a community that isn't next to a Buddhist retreat center when you're trying to encourage them to use mindfulness in their training of caregivers?
We haven't thought it honestly.
From my point of view, it's not so much about introducing mindfulness as a concept. It's about introducing a set of techniques, which I think can be scaled up. It's like, just do this, just do the morning circle, just check in the morning, the way that we showed. Just, and some of it comes naturally. We don't have to teach South Africans how to sing and pray in a circle. I mean, you can see how...
We should mention that the song there was not rehearsed. People just sing it, and that happens anytime, anywhere, all the time.
Yeah.
So there's kind of connection between people as well.
we're not talking about meditating 20 minutes every morning. We're talking about just being in a circle and reflecting back on your experience.
Yeah.
Or doing a body scan, which is like 2 minutes of, notice your head, notice your neck, that kind of stuff.
And then the other aspect of it is that whilst the practices are there, they're supported by a very good structure in the organization. So whilst we first noticed that they practice reflective practice and mindfulness, when we started to look at what was going on, we realized that they had a very good structure, and they followed practices and had rules for doing things, and everyone was mindful of those rules, and there was trust and respect. So that's another aspect that we've also documented in terms of a case study of the organization. And so you can't have an organization that is not well administrated and people are not committed and you don't have those basic values and then put mindfulness in. Yeah, so that's not going to work.
This was beautiful and inspiring, and I think it's wonderful that you were able to document it in order to share this experience and think about disseminating it. My question is whether you had any indication that sort of some of the techniques and practices that the caregivers were learning in these meetings, if they were imparting any of that to the families they worked with in providing care?
Yes, they were. Not just to their own families, not to just the families they were working, but their own families as well. They told about how they were using it to improve their relationships with husbands and partners, and to speak to their own children. And I think because they saw that it worked, it was easier to talk. We have other pictures of them talking to families. Yes, definitely they did.
That's great, and it kind of speaks to what Regine had asked about, like improving the mental health of the caregivers. I mean, if they're changing their own practices and behaviors, it would certainly be having impacts on how they manage their own stress and family life.
It was very interesting for me because someone introduced me to Neil saying he wanted to do work on caregivers, and I had just finished my PhD where I had done work on caregivers who were overburdened. And yes, I did find that they would, but all the literature that I was reading was about this overwhelming burden of care narrative that was going around in literature. And I thought, I don't want to see any more people that are overwhelmed anymore. And I thought, well, let me go see what this is about. And this is why I did it, because I thought, here are people that are getting it right, not just for themselves, but for the people they work with.
Thirusha.
Okay, I was just wondering if there was anything else in the organizational structure or in the organization at all that came about that might have contributed to increasing the longevity of the care workers, not just the mindfulness.
I think consultation, it really is, they kept on emphasizing to us that the organization had quite a flat structure in terms of consultation. And Sue Hedden, who was the director, would devolve responsibility very easily, and there'd be a group going on somewhere, or people were given a lot of leeway in terms of how they do things, as long as they checked back, not just with her, but with the group. So there was a lot of two-way consultation.
It's like they got some sort of autonomy over the work that they were doing.
Autonomy and then responsibility, not to a hierarchical structure, but to a community presence.
Other questions?
I have one. Thinking about like the network that the NGO is creating for the caregivers and how they have a structure, they meet weekly and monthly, and do you think that the main success is the technique itself, like the mindfulness, the reflective dimension of the technique, or the structure and the continuity of care to them, so that helps them continue care? So if you had to because the model has both, and both are create the synergy that basically shows this model as a great model. So I'm wondering, if we take out the mindfulness or those practices, do you think a model that has the openness of the NGO, the structure, can be as successful?
It's a difficult question, but I would guess that an openness, but what in terms of the mindfulness practices, the consistency with which it was practiced, and the regularity, and the fact that people reflected on what it was about was important. So I think I'm guessing that if you had to substitute something like regular exercise that people did together, or something that was outside of mentally giving care, but then reflecting on it and saying, well, why are we doing this? What is it doing for us as caregivers? It might work. That's just a guess.
Okay. Anyone else? Well, thank you very much. We'll be around in a few minutes to chat if anybody has any more questions. And Thirusha, thank you so much for joining us.